Michigan's Governor Gretchen Whitmer. Governor, thanks so much for joining us. President Trump praised the effort of federal government officials getting states necessary supplies. I guess my first question is, do you have everything you need from the federal government? Do you have the masks, the ventilators, anything you need to fight this virus?
No, we don't. Of course, Michigan's not alone. You were just talking to a doctor in New York. I mean, we know that across the country, governors are scrambling to try to meet the need of our people. I don't think that the federal government did the work on the front end to prepare, and now we are really scrambling. We've got, of course, you mentioned how the increase has gone up so dramatically, and yet we know that there is a lot more coronavirus present across the country, and of course in my state as well, because we're just not able to test everyone that we should be. We need tests, we need personal protection equipment, we need resources, we need regular, sustained, national strategic plan here and solid, clear communication. And I think these are all the important pieces that are missing from the federal government that we governors are trying to step up and meet that need.
The president said yesterday when asked about this cry from the governors that governors are supposed to be doing this work, and he said something along the lines of, we in the federal government, we're not a shipping clerk. What was your response?
You know, I'm just frustrated. I don't want to be in a sparring match with the federal government, but I can tell you this: we are behind the 8 ball because they didn't do proper planning, and now we are trying to work across state, across states to make sure that we're pulling in the private sector to step up and manufacture masks and personal protection equipment. I think that, the governors have really done some aggressive, smart things driven by science and facts and always what are in the best interest of our people. But every one of these decisions weighs heavily on us all because there are ramifications when you close schools. In my state, we have 1.5 million kids in schools. That means half of them, 750,000, are going without meals because they're not in the classroom. So we've got to make, provisions to ensure that our kids are getting fed. When we close bars and restaurants, those have ramifications in terms of people being out of work and not being able to pay their bills. And so each of these aggressive, necessary steps weighs heavy on all of us, but we're doing the best we can with the best science available to us, and we need additional support out of the federal government, to be sure.
So, Governor, top health officials are privately saying that they think that the stay-at-home orders that California and New York, Governors Newsom and Cuomo, have ordered really should be national. Cases in your state nearly doubled overnight. The number is expected to grow. You know what the rate is. It's doubling roughly somewhere between 2 and 3 days. I'm sure if I put sodium pentothal in Governor Newsom and Governor Cuomo and said, do you wish that you had done the stay at home knowing then what you know now? Do you wish you'd done it 2 weeks ago? I'm pretty confident that they would say yes. Why aren't you doing that? Why aren't all the other governors doing that?
I think every one of us is trying to share our best medical information and make decisions that are in the best interest of public health. It would be helpful if from the federal level, I've got a great deal of confidence in Dr. Fauci, but if they would communicate with us, clearly give us guidance about what the best practice would be. To have a hodgepodge of policies across the nation really isn't the wisest way to go. Now, that being said, absent that happening from the federal government, we're going to continue to move forward and be aggressive. We're communicating regularly with New York and California to understand their thought process and see if that's something that we need to do here in Michigan. We have been on the front edge of being aggressive, and we're going to continue to be. And we're always mindful of how important it is to be swift about it as well. So we're looking at all of these developments. The information is changing literally by the minute, and I would anticipate additional orders coming out of my office and in the minutes, hours, and days ahead.
You don't have enough tests, right? Have you seen any market improvement in the number of tests or the number of labs able to conduct these tests in the last week?
I'm it's my understanding that we've got more tests coming in, and I'm grateful for that, but nowhere near the amount that we would actually like to be able to execute. The fact of the matter is, without people to run the tests and labs to report the tests and give us the results of them, and then additional supplies and people online in our medical communities, we're seriously in danger of getting overwhelmed nationally and globally, and obviously as a state too. So these are concerns that we have. We know that COVID-19 is present in much greater numbers than what the test will tell you because we're under testing. And that's why it's really critical that every one of us takes it serious. Every one of us does our part. That means these stay-at-home, practices and the 6 foot perimeter and ensuring that you're not out in public when you don't need to be. These are really important. And when I see videos of people congregating, you're just endangering the public, and you're creating much more long-term problem for our economy. And that's why everyone's really got to do their part and take this seriously.
Governor, you've asked President Trump to activate the National Guard in Michigan to help with the response. What role do you want the Guard to play?
Well, our Guards people are trained. They are trained professionals. They are, steeped in logistics. If every governor from around the country has asked for the same authority, that the federal government give us access to the logistics, but they're under our command in each state, we can put Guardsmen to work in terms of making sure that our veterans' needs are being served, in terms of ensuring that communities have access to fundamentals, to everything from food delivery to ensuring that as products become available in terms of those PPEs that I was talking about, that they get to their destination. To supplement the work that we're doing at the state, where we desperately need more bodies who are trained, who are able to help us amplify what we're already doing.
Governor Whitmer, Democrat of Michigan, we thank you so much for joining us today. Thank you so much, and stay in touch. Let us know what you need.
Will do. Thanks, Jake.
Okay.